Thank you, Adelaide. Our second presenter for this session is Dr. Viswanath. Vish is the Lee Kum Kee Professor of Health Communications at the Harvard T.H. Chan School of Public Health and the Dana-Farber Cancer Institute. Using a scientific approach to health communications, Vish will share what we know from social science research on what communication strategies have worked and perhaps what have not worked. He will also share how we can improve communications literacy. Vish, welcome.
Thank you so much. Thank you, Nico, Megan, and members of the round table invited me and the staff. Thanks so much. So Adelaide has done an absolutely wonderful job of really setting the table from an agency perspective. So what I want to do is contextualize that from a data perspective and cover some key takeaways based on this, but spend a bulk of my time on what we call as inequalities in communications and how around issues of disparities and diversity. I won't say a lot about it, but what we are, I think in many ways, I think we are in very privileged times where we are seeing these two amazing revolutions in life sciences that we are all benefiting from, and certainly I think that it's not the primary focus here, but it's something that contextualizes what's also happening in parallel in what we call as a communications revolution or the informatics revolution. The really changes in information and communications technologies and how they're influencing the way we interact and relate to each other, as Adelaide has so eloquently described to us. So what are the implications for this? So what I want to do is really provide you, kind of a distillation of 5 key takeaways. These are somewhat simplified, if not simplistic, but hopefully we can elaborate and amplify it during the discussion. So one, I think, as Adelaide said, there is a proliferation of platforms and information and misinformation. So some interesting data are being provided. The couple of things about this proliferation of platforms, it is not just about consumption. I think consumption is important, and what we in our field talk about exposure. And we always struggle in what we mean by it, but exposure to information. But I think what is adding complexity to the issue is that in terms of information generation, right? So anybody can be a producer, given that the barriers to production of information or misinformation have become very easy. So anybody is an expert now. In some ways, it is a good thing, democratization of information, but it's also democratization of misinformation. So that's one issue. The second is, so we are generating a tremendous amount of data from a variety of sources. And of course, as Adelaide said, the networked environment is another characteristic of it. Just to give you an idea, we are actually generating a ton of data. This is just one piece of data here. We are generating about 2.5 quintillion bytes of data. I have no idea what a quintillion is, so I had to look it up. And it's estimated that we are generating 1.7 megabytes every second, and so on and so forth, right? So, and you can go on and on, as earlier figures have shown. The point of this is the kind of how we are increasing them, the kind of data that we are generating, within the span of, almost 7 years, with 10 times more. Again, I did not know what a zettabyte was. I could barely spell it until I figured it out that it's, 44 trillion, gigabytes, right? So there is a ton, if that's a much better word than zettabytes and quintillion, right? So people are being bombarded. Information is circulating all around the world, in this way. So this is the challenge, I think, for those of us who are interested in more strategic interventions on variety of risk factors, the sheer amount of information that is being generated and circulated with very limited gatekeeping. So this is the challenge. I think, it's very limited gatekeeping. I think, despite all the criticisms people have about journalism, I still value journalism because journalists were important gatekeepers in some ways. We could work with them at one time, but that's not the case anymore. And that provides a particular challenge for us, I think. So that's one takeaway. A second takeaway is the production of health information is not in the realm of scientists alone, right? This is again another challenge. So we who are in academy, doing this kind of research, and the life sciences revolution I talked about is generated whether it is in private labs. I live in Boston and Cambridge and Boston, and the private labs do generate a ton of information there. I think and there are places in the country where a lot of it is generated. But the point is, it's once it leaves the arena of scientific arena and enters the public arena, the whole host of actors and stakeholders control the distribution, interpretation, misinterpretation, reinterpretation of that information, right? So whether it's journalists, whether popular culture, social media, private sector, activist groups, and you can go on and on. This is just an indicative list rather than an exhaustive list. We particularly underestimate those of us who are in strategic communications, and I've spent my lifetime understanding the impact of campaigns and assessing the campaigns. We particularly underestimate the so-called oppositional communications, right? The private sector communications. And if you think about it, they too are influencing perceptions of risk. They too are communicating about risk, or miscommunicating about risk, misperceptions of risk, right? They are also promoting social norms and risk behaviors. Particularly if you look at the best documentation is in the area of tobacco. Tobacco industry, we have a very good idea of what they're doing, a little less so on other areas, but we are trying to figure that out now in that affects obesity. Let me give you an example. Some of you must have seen it. I have used it before. If you take three prominent brands, right? So Coke, Marlboro, McDonald's, I have nothing personal against them, but here, think about how much they are spending on marketing communications, right? So this roundtable is about obesity, but think about it, right? So Coke itself, right? And also one brand has spent, we have been trying to look at the data. I'm sure Edelman has more reliable data. We are public, so we rely on public use data sets. $4 billion, $3.5 billion in 2014 alone. So we are trying to get this information. But think about it. As one senator said, $1 billion here, $1 billion here, $1 billion there. It pretty much adds to real money. So it's just one brand, spending, $3.5 billion, and McDonald's around $1 billion. Fortunately, around tobacco, we know it because of the laws. I think of the challenge by the attorneys general. They spend about $10 billion on marketing communications. They have to declare this, thanks to CDC and Stan Glantz and others. We know this information now. But the point of this is, what I'm trying to say is that it's just not us. We're trying to promote risk and reduce risk, but it is this other kind of industry on the oppositional side. So when people get this information, they're not just getting it from us, or trying to address risk issues, but also getting it from other people, right? So that's one of the challenges. A third takeaway is data, which we talked about, both of us, is not information. Information is not communication. Right? So there is a lot of information out there. There are a lot of data out there. But that doesn't necessarily mean, as was said earlier, that people are able to absorb it. Particularly the kind of groups I work with, have a lot of daily hassles, what we call a social determinant issues, social challenges, and trying to really think through about some of these issues is very difficult. right? So if we think about it every day in a quotidian fashion, you open whether it's social media, whether your newspapers, whether it's television, whatever it is, it doesn't matter. There is a study du jour that is being reported in the media, right? So, and so one day coffee is good for you, the second day coffee is bad for you. Just for your information, coffee is actually good for you. As someone who drinks coffee, this was a great relief for me. My colleague, I think Sarah somewhere, Sarah is here. My colleague Frank Hu and his research fellow have done a review of this. So I was trying to blackmail him and said, you better come out with good findings, and they did. So good means acceptable to me. So actually coffee is good for you. But the point is, so what are people supposed to think when every day there is a study that quote unquote contradicts each other? That's not how science works. Science works cumulatively, but people don't necessarily have to have an understanding of the science, right? So that's why they say these people cannot make up their mind, and it is so confusing. So what are the, and if you are like me, I'm not only on different social media, but also on WhatsApp, because I work a lot in low-income countries and India and other places. And these are the kind of information. Every day there are at least 5 to 10 messages on WhatsApp, that talk about these kinds. Maybe you didn't know this, that you should not stand and drink water, but apparently that is an important item that goes around. Or you can become a doctor in 30 days. I don't know, some of you are wasting your time. Spending 5 years in a medical school or 10 years, So what are the consequences of something like this, right? The consequences are that people get confused because of this contradiction. This is from a national survey. I think April may have more to say about it in the afternoon. This is the Health Information National Trend Survey, one of the first public use data sets in health communications, where, in one statement, 50% of the people, more than 50% of them agreed that everything causes cancer. Of course, that's the way news is produced. News is being disseminated. 15% said nothing could reduce a person's risk of getting cancer. We know almost 50 to 60% of the cancers can be prevented, right? 20% to 25% from obesity, 30% from tobacco reduction, infections, we can between liver cancer and HPV and cervical cancer. So we know that despite that, people think, they can't do much about cancer. And there is an inaccurate understanding of disease etiology, So we have, how the causal attributions they make for what people, for disease conditions are also wrong. People misstate them. I don't have the time to go through all those data here. And lifestyle behavior, which we think is one of the significant causes, for diseases, is ranked very low compared to other things. So this is an interesting problem. And then we have social media. We talk about social media as echo chambers or filter bubbles, but actually what we have been trying to document is, this spiral of amplification, where something starts in one corner, in social media, but it starts spiraling out, and somehow, when it starts going into the larger world and within social networks, it acquires a certain legitimacy, that message. So I'm spending a lot of time these days thinking about vaccination, and I can tell you how this kind of amplifies. I'll be happy to elaborate later again. So the fourth point is how you say is as important as what you say, right? So there are varieties of saying this, and those of us who have worked in the tobacco world like to scare the heck out of people, what we call as fear appeals, but there are other ways. Storytelling, narratives are another way of constructing messages. I wanted to give you a couple of, because certain features or formats of messages interact with individual attributes and lead to certain kinds of information processing by the audience, right? So I want to give you one example of constructing message, what people have called framing. Deetram, who is in the audience today, has done more work on framing than I can even spell framing. So I hope he forgives me if I get it wrong, so I don't care at Deetram, So for example, this is a wonderful story. We have been doing for 15 years what is called as community-based participatory research in Lawrence, Massachusetts. And this is a story from that town where Elizabeth Rivers won the biggest loser contest, right? And so this was amazing, right? I don't know how many of you watch television here. Maybe you all read the New Yorker and don't watch TV. But, this is one of the biggest programs and it was huge news in the community that it is a local person who won it. And what she said in all sincerity is, I could do it. If I could do it, anybody could do it. And I want to make sure that those of us in Laurentians, as they say, can also lose weight and improve our physical activity, get, our diet right, etc. What she's not saying is what is the kind of help or assistance she received from a variety of contextual conditions, right? Whether it is, if you are on the Biggest Loser contest, you get a personal planner, you get a diet plan, and on. All the supports, social systems that are required to really change that and, contextualize that individual behavior, I think, But this is a classic case of relying, blaming the victims, putting the question and the onus on the individuals, I think, And framing is really critical because what you leave out and what you leave in is important. This is my favorite because, these are winnable. Some of you are actually engaged, involved in it. Some of my colleagues and friends were involved in this battle. These are winnable battles. We lost them, and there is entire cases around this. We lost them because, we have not been able to adequately plan for these things and fight these battles, in a thoughtful, winning way. The last one, this is where I want to spend a little bit of my time in the few seconds I have, is, inequalities in communication. Health, like wealth, is unequally divided. And as you know, I don't have to talk about, Nico talked so eloquently about inequalities in obesity. Similarly, there are inequalities in communications. What we mean by that is there is differential distribution of communication resources among different social groups. In the case of communications, class matters. Those who are from higher socioeconomic position have better access to information. Race matters. Ethnicity matters, place matters, right? So those of us who are in the urban areas have better information compared to rural areas. We don't often pay attention to it because our national surveys don't include enough people from underserved groups. That is a problem. We don't highlight this issue, but we have been documenting. If you look at internet, everybody talks about internet, but if you look at internet, penetration of internet is directly associated with the gross national product of a country, right? This is my favorite slide in many ways. If you look at knowledge people have, one of the most interesting is the top half of the panel says among those who have college degrees, whites have more knowledge about science compared to African Americans and Hispanics. What is even more interesting is the lower half of the panel, where again, those with some college, whites have more knowledge than African Americans and Hispanics. But more interesting, whites with a less college education or less have more knowledge than African Americans with a college degree. This is what we call as intersectionality. Right? This is important to know. It says something about the system we created, the system we designed, which doesn't allow people to take adequate advantage of these revolutions, I think. So I can go on and on. You take, it's very fashionable to talk about social media and internet because that's what we do routinely, right? All of us, a number of you are doing your text messaging, etc., because we are so used to it, right? But the fact of the matter is there is a substantial chunk in the world, part of the segments in the world who do not have access to these things. We have documented repeatedly, that, even phones, cell phone penetration, there are more cell phone subscribers in the world today than toilets. Right? But even there are significant differences. People have trouble. People we work with, we work with a lot of so-called poor and underserved, I don't know what term because every term carries baggage, but people lose connections with cell phone. People have difficulty in using, tablets. This is something that is not routinely talked about, I think, and we have documented these inequalities exist in the form of information seeking, avoidance, or misplaced beliefs. And in fact, recently we published a paper that it is even associated with mortality. We have not made a big deal. We are still looking into the data, but it shows that communication inequalities are not trivial. Actually, these are very significant and serious issues, I think, And then those of us who study with the underserved or poor also know that there are a lot of daily hassles, as I said. What I mean by that is, there is a differential allocation of attention because there are pressing demands every day. This kind of a juggling they have to make, to pay attention, whether it's the kids, whether it's a fee, whether it's a rent, whether it's a debt. And so it's very difficult, and there's a lot of cognitive overload which precludes them from processing the kind of information that they should process, right? So what do we need to do, I think? What we need are institutional solutions, not individually based solutions, but institutional solutions, because inequalities are not natural. These are designed, this is because of the design of the system. We designed it, right? We have constructed the system, so it is in our hands collectively to design a system that can bridge these inequalities. They don't have to open up in the first place, I think, And the regulation part, ICTs are outpacing our ability to regulate. And what can we do about it? This is a huge issue, including on algorithms, where, algorithms have built-in discrimination features. So I think we really need to struggle with these issues as we go along, and hopefully we can talk about it. Thank you so much.